Hi everyone, this is Dr. Fred Macy. Today I will touch on women's health. Fortunately, women have been blessed by evolutionary biology. Why? Because their ovaries produce estrogen, and this protects them from cardiovascular disease, at least during their child-rearing years. But once they get into their late 40s and early 50s, which is when I see many of my patients as a cardiologist, there's a catch-up phenomenon on cardiovascular disease. That means strokes, heart attacks, congestive heart failure, and other complications start to ensue. This is why part of women's health, aside from a general basic evaluation of their complete labs, including their lipid panel, their hemoglobin A1C to assess as to whether they are pre-diabetic or diabetic, their thyroid, their hormone status, FSH, LH, estradiol, and testosterone in females, as well as other essential labs such as renal and hepatic function. When one puts all this together, one can map out an appropriate lifestyle modification program, smoking cessation when needed, controlling other habits such as alcohol consumption, and optimizing an exercise program. Many women in their late 40s and early 50s, unfortunately, have some excess weight. It is absolutely important for every woman to embrace a healthy diet. And in my opinion, the Mediterranean diet is the optimal diet for most patients. That is one that is predominantly plant-based with vegetables, legumes, whole grains, fruits, olive oil, avocado, and limiting the animal products such as meats, especially red meat, to no more than 2 or 3 6-ounce servings per week. Also, women should exercise, and beyond aerobic exercise for 30 minutes or more 5 times a week, women should do at least 20 minutes of resistance training 3 times a week. Why is this? You want to avoid frailty in your older years. You don't want to lose muscle mass. You want to maintain the strength to be able to sustain your posture, walk without tripping, and avoid dreaded complications that occur in many women who unfortunately in their postmenopausal years develop osteopenia, osteoporosis, and pathologic fractures in the wrist, the hip, or the lumbar spine. So you want to be on proper nutrition, as I mentioned with the diet, plus some supplements that are known to be extremely helpful for women, such as 1 gram of elemental calcium a day, at least in my opinion, 2,000 international units of vitamin D3, and on occasion B12, 1,000 milligrams a day to maintain optimal health. Some women who are at low risk for female malignancies such as breast cancer, endometrial cancer, ovarian cancer may be very good candidates for hormone replacement therapy with various estrogen formulations. Some prefer a patch because this is the one that actually is not only it is FDA approved, but also has a lower risk of venous thromboembolism. Absolutely necessary to be on hormones is that you do not smoke. You cannot combine tobacco use and hormone replacement, or you dramatically increase the risk of venous thromboembolism, pulmonary embolism, and other complications such as strokes and heart attacks. So it's very important also for women to have screening mammographies. If you have never had a family member, you can start at 50 to have your yearly mammogram. And if you have 2 in a row, you may wait now 2 to 3 years before you have the next one. But if you're at high risk, it's important to know your genetics. What are your genetic factors that may predispose you, especially if you have a direct family member, such as a grandmother, mother, or an aunt or a sister who has had breast cancer. These are individuals that need to be followed carefully and should have screening, not only self-exam, but mammograms every year. Lastly, some may require an ultrasound if an anomaly is detected. So all of this, a prudent provider will be able to guide you through to avoid any of the dreaded complications. Lastly, mental health. It is common for many women, especially in middle age, to start experiencing general anxiety disorders, mild bouts of depression. Some, unfortunately, treat this with substance abuse, including alcohol and others, And so counseling is very important. Being transparent, being open with your provider to get appropriate evaluation, appropriate recommendations. Never judgmental, not moralizing or talking down to you, but rather from an understanding perspective, so you can actually navigate these difficult times in a successful fashion without being a detriment to your health. And hopefully live into your 90s without any complications such as dementia, strokes, heart attacks, or frailty, such that you can't even get out of bed without help and cannot walk without the aid of a walker and or are permanently wheelchair bound. So the general approach really is one where you need hand-holding and very humble and yet pertinent advice at every stage of life, especially after the age of 40 and certainly into the menopausal years. So hopefully this has been helpful and allows you to seek better health and embrace yourself with aging gracefully.